Hello and welcome to my channel. In this channel, we explain various nursing concepts in a simple form for a better and easy understanding. These videos could be used by both LPN and RN students as well as nurses who are trying to refresh their basic concepts. My name is Nasmosh. This is our introduction video to our cardiac system video series. And in this video, we're going to talk a rough A&P introduction. We're going to also talk about our cardiac labs that we should know, as well as various diagnostic procedures used in relevance to our circulatory system. So our cardiovascular system. Our cardiovascular system is also known as our circulatory system, and it's composed of the heart, the blood vessels, as well as blood. Its function is to deliver not only also nutrients to all other body cells and the removal of carbon dioxide and other waste products from the cells, from the body. The heart is a muscular muscle, right? It's a muscle. And with it contracting, the contraction of the heart pumping, it sends oxygenated blood to the rest of the body for perfusion and deoxygenated blood back into the lungs for oxygen induction as well as carbon dioxide removal. That's our rough A&P for our cardiac system. So some labs you need to know about our cardiac system. So cardiac enzymes are normally released into the bloodstream in response to an ischemic event to the heart muscle, like an MI, myocardial infarction. And what is an ischemic event? An ischemic event is when oxygen doesn't get to a specific part of the heart and it causes death of that part. So our cardiac enzymes that we need to know include creatine kinase, CKMB for short. It's specific to the heart and its value is normally 0. And if we have an ischemic event, it will be elevated for 2 to 3 days. Troponin T and Troponin I. Troponin T and Troponin I are very specific. They're the most specific and accurate to the heart. So with Troponin T, it should be less than 0.1 nanograms per liter and it stays elevated for 10 to 14 days if somebody has an ischemic event. For Troponin I, it should be less than 0.03 nanograms per liter and it also stays elevated for a range of 7 to 10 days in an occurrence of an ischemic attack, right? Myoglobin. Myoglobin is elevated due to heart damage or any skeletal muscle damage. So this is not really specific to the heart. And it's not specific to the heart, as we said, and it should be less than 90 micrograms per liter, and it stays elevated for 24 hours. Let's talk about cholesterol levels, because cholesterol goes hand in hand with our circulatory system. For total cholesterol levels, we need to see less than 200. For HLD, also known as a happy cholesterol, for women, it should be over 55 and for men, over 45. For LDL, the lousy cholesterol, it should be under 130. And for our triglycerides, it should be between 35 to 135 for women and 40 to 140 for men. So let's talk about cardiac procedures or cardiac diagnostic procedures that we could see in relevance to our cardiac system. So one of it will be labs. And in labs, there are various labs that they could be drawn. They include serum electrolyte levels, ESR, creatinine protein, our blood coagulation tests, right? Like PTT for heparin therapy, PT for warfarin therapy, BUN and creatinine. These are specific to our renal function and perfusion as well. And the serum cholesterol that we talked about, cholesterol levels, BNP, our enzyme tests. Those are our cardiac enzymes that we talked about. And we could also have an ECG, and what an ECG is, a recording of an electrical activity occurrence in the heart. The T wave inversion indicates an ischemia. ST segment elevation, there's an injury somewhere, and a Q wave enlargement, there's an infraction somewhere. Cardiac catheterization is also another cardiac diagnostic procedure, and this is a procedure that involves advancement of a catheter to visualize femoral artery. A dye might be injected for visualization and treatment with the precocious coronary intervention, which is a PCT. With coronary treatment, you could either have a coronary angioplasty or a coronary stent. Angioplasty is where a balloon-tipped catheter is placed to open up the vessel, and the stent, it's used to prevent blockage. So some uses for this cardiac catheterization will be, of course, to perform the angiography or perform a PCI. We also could obtain blood samples that inform us about the cardiac structure as well as determine our cardiac output. And when we're doing this cardiac catheterization, there's some nursing interventions that we need to know prior to catheterization and after catheterization. So prior to catheterization, we always verify consents. Our work is to verify that the patient signed this consent willingly and they do understand what they are getting done. We need to approach, we shave prep the site. We place the patient on NPO for 6 hours prior. We mark our distal pulses, and we explain the procedure may have it will leave a metallic taste to the client, and the client may feel flushed when they induce this dye. And also we verify the client does not have any allergy to what? Dye or shellfish, because we might induce this dye into the patient. And after catheterization, we always monitor our blood pressure, apical pulses every 15 minutes for 2 to 4 hours, right? Because we are going into a main vein. We perform neuro assessment every 15 minutes to rule out any hemorrhage. We monitor for bleeding and hematomas at the catheter insertion site. We apply pressure for at least 15 minutes to prevent bleeding or hematoma formation. And with our patient who are prone to bleeding, we do it, though we hold it even longer. We assess for chest pain, right? We keep the extremities extended for up to 6 hours, between 4 to 6 hours. We maintain bed rest, no hip flexion, no sitting up in the bed because it increases pressure. And we also increase fluid intake to flush out that dye. And our last diagnostic procedure that we need to know in response to our circulatory system is our TTE. It's a diagnostic tool used to visualize structures, including valves and heart function, and it's used to diagnose heart failures and murmurs. So pre-procedure, what do you need to do? As a nurse, you need to have this patient on NPO for 6 to 8 hours prior to the procedure, and we need to clarify the medication to be administered with the provider. Post-procedure, what we need to do is to assess for gag reflex. It's important because if somebody's gag reflex is not back, this patient is at risk for what? Aspiration. We monitor respiratory efforts as client is removed from sedation, right? Because sedation induces respiratory depression. We need this patient back up and breathing. And we observe for oral secretion, for like blood tingling secretions is common as an early. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.